Welcome to Sky Women. I'm your host, Dr. Carolyn Moyers, a wife, mom, and board-certified OB-GYN. This is a place to educate, empower, and inspire. Join us each week as we share the power of women's stories. Real women, real stories, real inspiration. Put on your stretchy pants. Let's get going. Welcome, Sky community. Welcome back to another episode of Sky Women. Thank you for joining us today. We have with us today Kathy Fritz, who's a board-certified master hormone coach who helps women in perimenopause and menopause experience relief from hormonal symptoms like fatigue, hot flashes, moodiness, and insomnia. Her clients lose weight, rediscover their energy, feel sexy, and stop thinking they're losing their minds. Kathy's background in education gives her the expertise to individualize material so her clients can go from where they are to where they want to be. Welcome, Kathy.
Thank you. It's great to be here.
So what does it mean to be a certified health coach?
So,
because there's a lot of information out there. And so I want you to help us to kind of weed through all the noise. What does it mean? And what should we be looking for if we're looking for a health coach? And why would we seek a health coach?
all of these are great questions. Let's start with weeding through. Okay, so the term health coach, super underregulated. Right. You can do a 6-week self-paced course and call yourself a health coach. So the term board certified health coach actually does mean something. In order to be board certified, you have to go through a certain type of course that has been certified by an external body. You have to have sat for a particular exam and then obviously pass that exam, which not everybody does. It's a hard exam. So that's a good way to already kind of weed through. You really want to work with a board certified health coach. So that was the first part. What was the next question?
Well, so weeding through the noise, and then why would we work with a health coach? So very often I see this typical patient who is tired, can't get a full night's sleep, has gained weight and can't seem to get any off, even though she's doing all the things she used to do in her 30s. She might be having hot flashes. She just doesn't feel herself anymore. She's super agitated. She may have been to see 3 different doctors before coming in to see me and has basically been told it's all in her head or it's too early to be menopause, which we know that 7 to 10 years you can be having symptoms around menopause. Menopause is specifically stopping that cycle, right? After 12 months without a cycle, you're considered menopausal. But because of all of these symptoms, typically whenever somebody comes to see me because of the unique arrangement of my practice, it may take a 60 to 90 minute appointment for us to really kind of start unraveling all of these different symptoms and kind of get to what are our health goals and where do we go from here? So I would imagine then that maybe partnering with a health coach may be a more affordable and more supportive route to go. But talk to me about the typical people who are coming to find you and how you're partnering with their healthcare team.
Well, you just described my typical clients as well.
Okay.
And I am so grateful when they find an MD, or a DO or somebody in the medical field who really listens to them, takes that 60 to 90 minutes. And so health coaches are a great additional resource. So you meet with your doctor, you guys have a plan, you've got some big goals. Then the health coach links arms with that client and walks week by week with her. So when I work with a client, we meet for a minimum of 3 months. That's really how long I want us to be a minimum working together for a variety of reasons. If she's still bleeding, I want to go through 3 cycles with her and I want to see that cycle over the course of that time. Yeah. I want to make sure that we have enough time to see how the food movement and lifestyle changes that she chooses to include in her day-to-day life, how those are impacting her. And are they decreasing the hot flashes? Is she getting better sleep? So working with providers is essential. A health coach is not instead of a doctor. A health coach is definitely in addition. And I truly see myself as having the opportunity to alleviate some of the I mean, you don't have all the time in the world as a doctor to be constantly with your clients, your patients. That's me. I have that time. So we're meeting on a very regular basis and walking together. I think it's so awesome when doctors help their patients create some goals that are meaningful to the patient. So then when she comes to me, she's already done a bit of that groundwork, that kind of big picture work.
Right.
Get really granular in her goals. And we say, okay, so here's your vision for where you'd like to be. What do you see as the first few steps? Where do you see, something is not quite right in your life? And so some clients start with food choices. Some clients like to start with movement. Other clients start with stress. I mean, we could do a whole episode on stress and the problems of stress, and specifically perimenopausal and menopausal women.
Yes. Yeah, I think it's really a time in life where your kids are getting older and you've got a whole new set of problems versus, pre-K kids.
Yeah, that's a good point. Yeah.
And you're sometimes taking care of ailing parents and you're in the throes of your career and you're also wondering, well, what's next for me? I mean, I think that there's a lot of this emotional and increased stress at this phase in life that it would be really beneficial to have somebody to partner with who has a good understanding. So I love that you have niched down to peri and postmenopause. Specifically, why did you choose that area of medicine?
Because there's such a void of quality information.
Agree.
Such a void and too much misinformation.
Yes, agree. That's why we have HRT clinics on every corner who are taking advantage of women, in my opinion.
Gosh.
Yes.
And I'm not opposed to HRT. Bioidentical hormone therapy can be great when it's warranted, but too often, to your point, it's happening too fast. And it's just the quick, it's like the pill for, people in their 40s and 50s and beyond.
Right. So yes, I think that it really does take a personalized approach and an understanding that hormone therapy is not going to solve all, right?
Yes.
Just like you said, what are the stressors in our life? Are we getting adequate sleep? Are we hydrating? Are we eating well to nourish our bodies? Are we physically active and doing the right things to still feel strong in our bodies and to burn calories? There's just so much misinformation. You're absolutely right. I feel like we do a mother-daughter puberty course at our practice. Cool. And I feel like I need to add a menopause course because, there's so many questions around it and we really need adequate information. So I will say, if somebody is in their peri and postmenopausal years or is having all of the symptoms, people can go through premature menopause. And so if you're having any of those symptoms, look for a North American Menopause Society certified practitioner for your menopause care so that you're getting quality evidence-based care.
Yeah. And remind me, what do you have to do? Because I know that you have that certification. So what did you have to do to get that?
Well, it's additional training, additional education, and you have to pass an exam. And then there's certain continuing medical education that we have to do to maintain that. So, in residency training, there is just, in my opinion, an inadequate education on menopause medicine. We kind of get the bare basics. And I think a lot of it was misconstrued by the Women's Health Initiative and the way that was portrayed. And so I think that if you really want to take great care of menopausal patients, then it takes more detailed education.
Yeah, for sure. And that's exactly why health coaches have specific areas of interest, that they should be focusing on, because you need to specialize. You need to, in order to really serve the people who are coming to you.
Okay, I've got one in labor to go admit. So what does it look like for a typical client to work with you?
So I always start with a free coaching call. It's 30 minutes. And I just ask the potential client to talk to me and to tell me what's going on for her. I'm sure this happens in your practice too, by just allowing women to have that space to talk about what's going on. It tends to be a little emotional.
Yes.
I don't know if clients cry in your office.
Absolutely. Absolutely.
So it's a big relief, I think, for them to finally be asked really poignant questions and then be listened to. Coaching is less about answering questions and more about holding up a mirror. So in that first session, I just hold up a mirror a whole lot and reflect back what I'm hearing. And if at the end of that free coaching session, she and I both feel like this would be a good fit, we agree to do that. Because I'm board certified, I have to use a HIPAA compliant platform. So I then send her everything she needs through that platform, including 2 questionnaires. One is kind of a general intake, typical, what you'd see. And the other one's very specific to hormones. And it's a pretty lengthy one, but just a simple yes, no. So that before we even meet, I have an idea of what her hormonal landscape is like according to her symptoms.
Right.
I'm sure you do blood work and you can give that feedback because I'm not a doctor. I don't do blood work.
Right.
But I can look at her symptoms and say, this is what this indicates to me. And so then we have a 1-hour intake meeting. So like you, that 60-minute minimum that tends to go over because again, I'm asking a lot of follow-up questions, but I'm also offering coaching. I mean, as a health coach, I'm always reflecting back, offering coaching because that's my job. That's what I do. And so once that intake meeting is through, we set up that weekly meeting, which is 30 minutes long, and we check in on her progress, on her goals. We make additional goals, we make modifications, and we celebrate success. We celebrate reaching goals. We celebrate having experiences that are new and different and better. And then, we walk through for those 3 months. And then at that point decide, okay, shall we continue? Or do you feel like you're at a good place? And that is, an ongoing conversation a lot of times. So it's a delight and an honor to walk with women through this time, through what can be a really hard time. And to your point where there's kind of new stuff, right? The kids are older, the career, how that's going. How's the partnership at home?
Right.
I often women will say, like, I thought we were just going to talk about hormones, but we talked about everything.
Right.
And that's because everything impacts our hormones. Our hormones impact everything.
Right. Yeah. Okay. Amazing. So how can clients find you?
So my website is kathyfritzcoaching.com.
Okay.
And you can find me there. And I am on Instagram a little at Kathy Fritz Coaching. I was super active and then have kind of taken a step back from social media. It can be a bit much and was adding stress to my life. So for my own hormonal health, I had to take a step back, but I pop on every now and then. But really just my website is a great way to kind of get a sense of what I'm doing and to set up an appointment right from there to get that free coaching call. What's the worst that happens? You get free coaching.
Right. And there's a lot of evidence behind coaching. And I know some people think it's woo, but I tend to believe in the woo.
Oh, I'm a big woo believer.
I mean, I think that when we have our mindset right, whenever we can really be heard and have that reflected, I think it's with a goal in mind. I mean, it's different than going to counseling or therapy, which sometimes that's absolutely needed. But with this coaching, it really helps you to get to where you want to go at an accelerated rate.
For sure. And I'm glad you brought that up. Therapy is looking backwards. Coaching is looking at your present and your future and having those two align and meet. So I'm glad you brought that up.
Yeah. Well, thank you so much for joining us today. So everybody can find you at kathyfritzcoaching.com. Thank you and have a great day. Until next week, be well. All right, Sky community, thank you for listening to another episode. This episode was sponsored by Sky Women's Health. As a reminder, we're in the Dallas-Fort Worth area, and we help relieve back pain and pelvic pain in pregnancy and beyond. If you are pregnant and having pain and you feel like you have no reliable way to relieve it, look us up at skywomenshealth.com, request an appointment, and we'll call to get you scheduled. As a board-certified OB-GYN with a neuromusculoskeletal medicine fellowship, I help you realign with hands-on drug-free treatment and relieve pain on the spot without medication. We'll help you maintain these results through your pregnancy and postpartum period. Every pregnant person deserves this, and we are so excited to serve you. You can find us on our website, as mentioned, or on social at Sky Women's Health, or you can call the office at 817-915-9803.
That's it for today. Until next week, be well.